Welcome to another episode of Dr. Frita's Medicine in the News. We are live. And today we're going to be talking about the hottest health topics in the headlines. We are going to talk about the Married to Medicine reunion and some nip-tuck confessions. That's right. If you were watching Married to Medicine last night, you heard that some of the ladies revealed some of the plastic surgeries they've had. And you probably are also aware that SZA talked about her breast implants being removed and how she loves her BBL. She calls it another type of accessory. So we'll be talking about the dangers of plastic surgery, the risks, and what you need to know if you're going to get plastic surgery. And then we'll talk about weed. Let's talk about marijuana. Why not? Should weed be legalized? We'll talk about what the Biden-Harris administration is saying, because they're talking about potentially changing the schedule of it. And then we'll talk about Delta-8. Have you heard of Delta-8 THC? It's like marijuana light, they say. Well, there was a survey done and a whole lot of teenagers are using it. So you need to talk to your kids, and we'll talk about some of the effects of marijuana. And again, should it be legal? March is Multiple Sclerosis Awareness Month. So we'll talk about some of the multiple sclerosis warriors. Christina Applegate, Jamie-Lynn, Sigler. Well, they on Good Morning America, they talked about their struggles with multiple sclerosis. A pretty raw discussion. They don't sugarcoat anything, but we'll talk about some multiple sclerosis awareness and some signs and symptoms. And guess what? March is also Kidney Disease Awareness Month. So we'll be talking to you about warning signs, how to know if you or a loved one has kidney disease. Lastly, my favorite part, the live Q&A. I want you to keep your questions and your comments coming. I will answer your questions live and on stage. So stay with me, keep watching, because this is Dr. Frita's Medicine in the News. Hello. I'm Dr. Frita, and welcome to Medicine in the News. And let's just get right into some of these hot, juicy health topics that are in the headlines. I am an MD who has had multiple board certifications, and so I love sharing my knowledge with you. Sometimes I'm a little bit messy, but I always give you evidence-based medicine. So let's get started. I will call up my co-host, Shador. Hey, Shador, how are you doing?
Doing great, Dr. Frita. How are you doing today?
Hi, y'all. Shador is my practice manager. She runs my medical practice, which is Midtown Atlanta Nephrology PC, where we study kidneys, high blood pressure, and we do a whole lot in the practice. And today, Shador is going to be co-hosting as we talk about the medicine in the news. I want you to come on in. Please be sure to like this video so the good people know that we're here giving this good evidence-based information. Make sure you subscribe to my channel. You see, we're up to over 700,000 subscribers because we give good, juicy, yet reliable medical information. And it's thanks to you, thanks to all the listeners, to the subscribers. So yes, come on in, like, subscribe, share, and let's get started. Shador, when I was growing up, Shador, many moons ago, 7 years ago, marijuana used to be thought of as the same as cocaine, crack, heroin. It was all bad. It was all drugs. This is your brain on drugs. But now we know that in 38 states plus DC, marijuana has been legalized for medical use. And then in 27 states plus DC, marijuana has been legalized for recreational use. You know what? You could just, let it all hang out. You don't need a medical reason. But now we have President Biden and Vice President Kamala Harris pushing to make marijuana, a little less stigmatized. They want to change it from being a Schedule I drug, which means that it is thought of as being just as dangerous as heroin and even more dangerous than fentanyl, which the data does not support that. And they want to change it to Schedule III. And then you have a whole lot of people who actually want to legalize marijuana. They want to legalize it. They want to make it so that we can use taxes off of it. We can regulate it. They want to make it so that we can perhaps do research. And so there are different, potential benefits, medicinal benefits of marijuana, but there's also some problems too. So I want to start off for anyone who is here in the chat. If you think that marijuana should be legalized, press 1. Okay. And if you think that it should remain, highly regulated, illegal, at least in some states, press 2. If you think it should outright be legalized so we can regulate it, press 1 for marijuana. Okay. And then let's talk about it a little more. Let's talk about it. Now, there was a study, Shador, that was done. Okay. And it's talking about Delta-8 THC. And we know that THC is a component of marijuana. Delta-9 is the one that most people are familiar with. Okay, when I say most people, I mean people who either study marijuana, smoke marijuana. The Delta-9 THC is the one that makes people high. Okay, it gives them that psychoactive feeling, that level of whatever they're trying to get to. Delta-8 actually looks almost identical from a biochemical perspective to Delta-9, but they call Delta-8 weed light. I guess kind of like Bud Light or like a diet soda. I don't know. They call it weed light because they say it makes you a little less high, a little less psychoactive effects, but it still makes you high. And here's the thing. Where marijuana is legal, Shador, there's actually not a whole lot of regulation on this Delta-8. And there was a survey done of high schoolers, mostly 17 years old, seniors, and they found that over 11% of them had tried Delta-8 THC, right? They tried this weed light. Well, is that a big deal? I don't know, because we don't have a whole lot of studies on Delta-8, but we do know that on a young developing mind, and we know a 17-year-old, like your frontal lobe doesn't even develop till you're 25. So we know they still have developing minds. There are some potential issues that Delta-8 could have. And beyond Delta-8 just being available, it's not just marketed in a way where it's obvious that it is marijuana. It's in gummies, okay? It's in cookies, it's in cakes, it's in breakfast cereals. It's in places where, kids normally go to for snacks and things like that. And a lot of the packaging looks like something that a little kid would love. And so you actually have some regulation in the FDA trying to get companies to not package it in ways where kids will find it attractive. But I want to know, what do you think, Shador, or have you heard people talk about, should weed be legal? Or have you heard of anyone getting a hold of this Delta-8 or having these gummies that look just like regular candy?
Well, I've heard of it before, of course. I actually have a niece who's a senior in high school. She doesn't talk about it, although I don't think she would partake in it. I don't know anyone, personally, but I have heard of it, of them legalizing it, or it's in gummies. It's been stories before they asking kids to watch out, who you get candy from, because it may not be Skittles, it may not be gummies. May have the TSH in it, and kids are getting sick from it, not knowing they're ingesting something they should not have, they're not used to taking.
Absolutely. Well, I will say in my research, I do know of plenty of people who partake in the gummies, the cookies. Now, the people I know of are adults, but I imagine if they're kids, maybe they wouldn't necessarily share it with me anyway. Although I think children can come to me, they can talk to me. But that was the whole purpose of this survey, like this anonymous survey. And I'm thinking if over 11% of seniors actually admitted to doing the Delta-8. Oh, and in that survey, even more of them admitted to actually using outright marijuana, the Delta-9, all of that. And so they surveyed the kids. I know that adults actually use it, but here's the issue. It's mainly with the children in my mind, because a young child who's 2 years old or so can get very sick. In fact, according to Poison Control, the calls that went in for the Delta-8 THC, this weed light, jumped up 82% in just 1 year. Okay, and people are mostly reporting nausea, vomiting, feeling ill, but that lets you know that it could potentially be a problem. And so my thinking is that it's not regulated right now. And if something is illegal, certainly it cannot be regulated. But if we find that benefits outweigh the risk, because we do know there's some medicinal benefits, if we were on a federal level to make it legal, does that mean that we could regulate it more, meaning instead of people having, synthetic weed or weed that's potentially laced with fentanyl, laced with PCP, would we then be able to have it stamped FDA approved marijuana, FDA approved Kush, whatever they would call it? If it's FDA approved, does that give us more control? Can we take those tax dollars, okay, and then do research on cannabis or marijuana overuse disorder? Can we do more official research for the medicinal purposes of marijuana, right? For the way that it can control pain, the way it can control nausea and vomiting in cancer patients, the way it can increase the appetite in patients who are anorexic or patients who have no appetite, who, you know, been treated with chemotherapy. It potentially could have some benefits, you know, and with the 38 states who have legalized medical marijuana, that's been somewhat of a model. One thing that's interesting, and I do want to know, has anyone voted one that we should legalize marijuana?
Yeah,
That's
we
what
actually have a couple of people voted one, and we have one viewer
Let me hear
rate
the
this
names.
record. I think Delta-8 or 9. C says, I don't remember it, but it's legal. You can order it from out of state once you verify your age.
Interesting. So once you verify your age, you can do it, because there's some places where they don't even have an age regulation. Okay. So, okay, for the person who said that think it should be legal, do you think it should be restricted to either 18 or above or 21 above, or whichever age? Do you think there should be an age restriction if it's legal, even with the Delta-8? And I'll tell you, I definitely think that if it were legalized, there should be an age restriction. I think at least 21. I might really say 25, because I'm gonna need your frontal lobes to be developed, but at least 21 if it's made legal.
Rate this record saying, you know, 18 above. 18 above. Rate this record, the one who's purchased, who said you ordered from out of state before. 18 above is what they're thinking. Yeah. And you know, we have a clip, Dr. Frita, about the Delta-8 and the sting high.
Let's see it. Do we need to come back to it?
1 second. Let's try this one more time.
All right. Meanwhile, y'all come on in. Please make sure you like this channel. Please make sure you like this video. You share the video, because we're going to be talking about a few more things. We're definitely going to talk about the risks of plastic surgery. And if you are considering it, just real talk, some things that you need to consider and the right questions to ask when you see your board certified plastic surgeon. Yes, I said board certified plastic surgeon.
All right, Dr. Frita, there seemed to be some missing audio here.
Okay. All right. Well, let's see. Now, in Oregon, they actually did at one point have it where the THC was made legal, but now they're talking about going backwards and making it where it's not legal again. And here's what happened. In Oregon, when marijuana was legal, y'all, that's my dog Shadow, and I don't even know what's happening. I guess Shadow wants to be on live. But in Oregon, where they had it where it was legal, they had it where if a policeman saw you and you were smoking, I'm sorry, by legal, they decriminalized it. They decriminalized the possession of certain drugs. And so while they didn't say it was legal, you would not be arrested if you just had a small amount, or if you were found smoking marijuana. You would get a citation and you were given a helpline, or at least that was the plan, for you to be given a hotline. But that didn't always work. And they found that only less than 1% of the people who were found like smoking in Oregon, when it was decriminalized, less than 1% went to the hotline. So now after 3 years, they're talking about reversing it and going back to making it like totally illegal, where you can possibly get jailed up to 6 months. So that's the deal with that. Yeah. All right. So now I'd like to talk about multiple sclerosis. Okay. So March is Multiple Sclerosis Awareness Month. And does anyone remember Christina Applegate? Okay. She was in that Love and Marriage show. And she played like the ditzy character. And she's someone who, you know, was known for being a very attractive person. She's an actor who's been in a whole lot of things. Well, she was recently diagnosed with multiple sclerosis. And it was while she was on a show, she actually didn't know that she had the diagnosis. And she said that in hindsight, she knows that she must have had the diagnosis even years before. started off with her knee buckling, and then she said there were times where she just couldn't feel her feet. And so she has the diagnosis. And so she, along with Jamie-Lynn Sigler, were on Good Morning America. And they did an interview that I thought was such a great interview, because when I tell you they didn't sugarcoat it. Do you have that clip? Let's see if we can play that of multiple sclerosis. We can look at these multiple sclerosis warriors.
Yes, I do.
Robin's exclusive conversation with Christina Applegate and Jamie-Lynn Sigler. You showed a bit of it to us yesterday. What a powerful friendship.
It's such a special, special friendship, as Rebecca and you both said. Christina says that Jamie has allowed her to be honest with others, and more importantly with herself, about her emotions facing MS, and that openness has helped her cope. After 4 decades in the spotlight, this morning, Christina Applegate, with good friend Jamie-Lynn Sigler by her side.
She's doing this because I have the tremor. So she's
Well, also because I love her. But
candid about her life since being diagnosed with multiple sclerosis in 2021.
Yeah. If you go and if you listen to that clip, you'll find where literally Christina Applegate, she talks about, she's like, I have my middle finger up to this disease. She's like, it sucks. She's like, I am a recluse because I don't like going out. She's like, it's hard, And when I look at her whole life, she's been literally since she was a baby. She had her first credit, Christina Applegate. And, you look at her now and you can see that she's been very, very, very thin her whole life, at least in front of us, in front of the cameras. But she has put on some weight. And for some of the treatments of multiple sclerosis, some of them may include like a steroid or medicine that can actually make you put on weight. And she just talks about how horrible it is. And there's something refreshing about that, because Jamie-Lynn Sigler, who used to play in Sopranos, I know y'all watch Sopranos, she said that when she got the diagnosis, she really felt pressure to always show people, I'm fine, I'm fine, I'm fine. And she never wanted to complain because she didn't feel like it was okay. She didn't want people to feel uncomfortable. She didn't want them to know how miserable she was for some days. But she says that through her friendship with Christina Applegate, that now she actually knows it's okay to say this sucks. Okay. And a lot of chronic diseases, they really do suck. And a lot of them are invisible diseases, meaning if someone sees you, you may look like you have no problems, but literally you can be suffering in silence. And so multiple sclerosis is one of those diseases. And so I'll tell you what it is. So Shador, it's one of the autoimmune diseases. We talk about autoimmune diseases all of the time, like lupus. And so when I say autoimmune, it's when your immune system, instead of just fighting bacteria and viruses, it turns on you and it starts fighting you. Okay, like an autobiography is a book about oneself. An autoimmune disease is an immune system that fights oneself. And so multiple sclerosis, literally your immune system, the antibodies are fighting the protective covering that's over your brain, your eye nerves, your spinal cord. So that's being attacked, which then means that it causes your nerves to be exposed, and it causes many scars, which is how it gets its name, multiple sclerosis, many scars. And so it can affect your vision, okay, because it's affecting that sheath that's over your eye nerves, your optic nerves. It can cause you to have weakness in your legs, your arms, your walk. It can cause all kinds of symptoms. And it's most commonly relapsing and remitting. I mean, you don't know when it's coming and when it's going, okay? You'll feel fine for months, and then you can't walk. You'll feel fine for months, and then your foot is numb. You feel fine for months. Now you can't see. And so it's unpredictable in a lot of ways. And yes, there are ways to manage it. There are certain medications, but there's no absolute cure. And quite frankly, we're not sure of the precise cause. We know it's autoimmune, but we're not sure of the precise cause. Some studies reflect that if you have a history of certain other autoimmune diseases, like autoimmune thyroid disease, then maybe that puts you at a higher risk. But it's really just a very difficult disease. And so I'm really excited that we have these two people who have huge platforms who are coming out and talking about it. And so again, March is Multiple Sclerosis Awareness Month. And so I really want people to make sure you check out that Good Morning America interview. And I have people very close to me and in my family who have multiple sclerosis, and they are warriors indeed, because even at times where they're feeling just like horrible, And for both of these young ladies, they are mothers, they work, their wives, and they have to kind of keep pushing and keep pushing. It was just refreshing to see Christina Applegate just kind of tell it like it is and say, this is horrible. All right. Does anyone in the chat know of anyone who has multiple sclerosis? If you know of someone who has multiple sclerosis, put a 3 up for me.
All right. We do have a viewer, Poppy Weasel. Hi, Poppy.
Okay.
Asked if multiple sclerosis could develop from previous medications.
Well, we don't have any evidence of that, but I will tell you that there are some autoimmune diseases where we do have evidence. So, for example, I mentioned lupus as an autoimmune disease, and lupus can cause a bunch of things. It can affect anything, the joints, the skin. It can cause a butterfly rash. It can cause lupus nephritis or lupus kidney disease. It can affect the heart. Some of the lupus warriors we know of are like Toni Braxton, who looks like $1 million, but sometimes she just doesn't feel well. She's been very open about her struggle. She's had lupus pericarditis, where you literally have like fluid and inflammation around the heart. Well, there are certain drugs, high blood pressure drugs, hydralazine, which can be associated with lupus. Okay. And so in saying that, I am not clear on what specific medications or if it's been identified, but if you know someone who has multiple sclerosis symptoms and they are suspicious that it could be related to a medication, I would recommend consulting with a rheumatologist, okay, or a neurologist, okay? And these are doctors who specialize in treating multiple sclerosis, and they'll ask the question and see if the research has been done, because with autoimmune diseases, they can be triggered by anything, even medication. So it's actually quite possible. Thank you for that question. Any more questions?
No, not at this moment, Dr. Frita.
All right. All right. So we mentioned that, let's see, and who was the first person who was in the chat today?
First person in the chat today, rate this record.
Yay, thank you, thank you. All right, you get the reward. What's the reward? Okay, just my joy and my appreciation. My joy and my appreciation. Oh, we have a 3. Who is that who pressed a 3? They know someone who has multiple sclerosis. Okay, is that person who asked the question?
Yes, Jewel Hudson.
All right, all right. Well, I pray you're the person
you know. This is interesting, Dr. Fisher.
We have what?
Interesting comment from Chicks Blue. I have MOG. A relative MS. I also have lupus. My optic nerve and left eye will be affected. Are you familiar with
goodness.
MOG?
Okay. So I'm sorry that you're going with that. Thank you for sharing, though. Thank you for sharing that. Because that's right along with how it goes. These autoimmune diseases are really, it's very frustrating, because once you have one, that can put you at risk for other ones. When we did the series, and if you go to my YouTube channel, dr.frita, you'll see where I did a series on that documentary, Where is Wendy Williams, where I talked about Wendy Williams' health, breaking down her illnesses. And you can see how once you have one autoimmune disease, it can really open you up for other ones. So I'm sorry you're going through these things. I do, of course, what I give here is medical information. It's not medical advice. I don't replace, what your doctor tells you. But if you're dealing with multiple sclerosis and you're dealing with these other autoimmune diseases, seeing a rheumatologist, seeing a rheumatologist and seeing a neurologist, a nerve specialist, you want someone who can give you the best shot of the most well-studied treatments, okay? And definitely you want to have good lifestyle management in any illness, eating a mostly plant-based diet. If you do eat meat, making sure that it's like fatty fish with mostly omega-3. You want to make sure that you remain well hydrated. You want to make sure that you have a good blood pressure, good blood sugar. You're seeing your primary care physician regularly. You're exercising. You're doing all the things. You're meditating. You're maintaining your stress. Maintaining stress, because stress can be a trigger. But thank you for sharing. I pray that you do better, that you do well. Speaking of hydrating. So hydration is good in general for general health, but you know what, Shador? It's also really good for your kidneys. And March is Kidney Disease Awareness Month. And so I want to talk to you about some ways that you know that you have kidney disease. Speaking of silent diseases, a lot of people, you know, I am a board certified nephrologist, meaning I specialize in kidney disease and high blood pressure. I have other board certifications as well. I have been board certified in pediatrics. I am board certified in internal medicine. I'm also board certified in obesity medicine by the American Board of Obesity Medicine. But as far as kidney disease, a lot of times dehydration can send people to kidney failure, and that's not common knowledge. And so you want to consult with your physician, you know, because you might have a fluid restriction if you say have congestive heart failure, if you have lung disease. But for most people, around 2 to 3 liters of water. So if you're talking about like a 16-ounce bottle of water, 4 to 6 of those a day is often needed in order to maintain good kidney function. That sounds like a lot of water. It might be, but let me tell you something. You don't want your kidneys to fail and to be seen in my dialysis unit. That's what you don't want. All right, but Shador, we have a clip where I'm talking about kidney disease, and then I'll run through a few of the ways that you can, a few of the warning signs of kidney disease. You have that clip?
I sure do.
Kidney disease is usually silent. Unfortunately, by the time patients are referred to me to take care of their kidney disease, it's often too far gone and it's already time for them to start dialysis or to get a kidney transplant. Many of the signs and symptoms of kidney disease are not obvious. So today, we're going to talk about it. I'm going to give you the top 10 signs and symptoms that you might have kidney disease. Keep watching. I'm Dr. Frita. I'm an MD who is board certified in Consultation, which is the study of kidney disease and high. All right, we have a hello from Dwayne Woods, MD. Hello, how are you doing? Thank you for joining us. Thank you for joining us. Come on in. Be sure to like. Y'all come in. Make sure you like so that YouTube knows that we're here. We're giving some good old evidence-based information. So far in Medicine in the News, when we're talking about these health topics, so far we've talked about weed. Should we legalize weed? We got some people who said yes. We talked about Delta-8 THC, what they're calling weed light, and how it's in gummies, it's in cookies, it's in cakes, and the packaging oftentimes looks just like the same packaging as very familiar candies and cookies. And we talked about how the rate of phone calls to poison control has literally gone up by 82% in just 1 year. That was just in 1 year. All right. And then we were talking about how March is multiple sclerosis month. We talked about the MS warriors, Christina Applegate and Jamie-Lynn Sigler. Oh, and I didn't mention they have a podcast that's coming out where they'll be talking. And now we're talking about Kidney Disease Awareness Month. So over 37 million Americans do have kidney disease, and oftentimes it's very difficult to know if you have it. And so make sure you go to my YouTube channel and you can see that whole video that we were just playing as far as warning signs of kidney disease. But I'm going to talk about a few, but I'm going to ask for those of you who are here in the chat, if you know of anyone who has kidney disease. Now, I'm not talking about dialysis, but someone you talk to and they've been like, I mean, dialysis, yes, I'm including dialysis, but if they've been like, you know, I got kidney disease, I got CKD, chronic kidney disease. If you know of anyone, please put a 4 in the chat and comment and let me know if they had symptoms or if when they found out they were shocked, or if it's you and you're willing to share, if you're willing to share about yourself. But put a 4 if you know of anyone who has kidney disease, because 1 in 3, okay, 1 in 3 has kidney disease as far as Americans. So if you're sitting in the room right now and there are 3 people, chances are one of you has CKD, and most don't even know it. So here are some of the potential warning signs and symptoms of kidney disease. 1, swelling of the feet and ankles, okay, edema. When your kidneys are responsible for your, of course, filtering out your blood and getting rid of excess toxins, but they're also responsible for your salt regulation, right? And so if you are holding on to too much salt, then you may also end up pulling in more water into your tissues. And so you can get swelling in your feet, your ankles, even around your eyes, a periorbital edema, okay, a swelling around the eyes. So swelling of the feet and ankles could be a warning sign of kidney disease, okay? Also, if you have foamy urine, I don't mean just a couple of bubbles, okay, when the urine hits the toilet. I mean foamy, like if you know those beer commercials, right? Where they have the beer going in, there's all that white foam coming up. If you're getting foam that stays, that could be a sign of kidney disease, because if you are leaking out protein, which is not normal, if you're leaking out protein, that could show up as foam in the urine. Now, the number one cause of leaking out protein is diabetes, which incidentally, diabetes is the number one cause of kidney failure. But here's the thing, a problem with the kidneys can cause you to leak out protein, but then the more protein you leak out, the worse you make the kidneys, okay? So you just have this back and forth. So yes, foamy urine is another warning sign that you could have kidney disease. High blood pressure, again, high blood pressure is the number two cause of kidney failure. So high blood pressure can ruin the kidneys, but then if you have kidney disease, it can cause you to have high blood pressure, okay? And there's other signs as well. If you have easy bruising, okay? If you bump up against something, all of a sudden you have a big bruise. If you're brushing your teeth and you're getting bleeding gums, okay, that could be an issue. And it's usually from something called uremia, meaning that BUN that shows up on your labs. If that's too high, then it can cause a problem where your platelets aren't sticking together properly. And there are other causes as well, other signs as well. One can be your breath. Your breath can have an odor of urine, okay? Bad breath can be a sign of kidney disease, or your taste. You can have a metallic taste in your mouth. But yeah, make sure you check out that video on this YouTube channel where I go over all of the warning signs and symptoms of kidney disease, and more importantly, what to do about it. Spoiler alert, start off by seeing your doctor. Start off by seeing your primary care doctor and asking what your kidney function is. On the labs that you get, as far as the kidney section, that's where it has the sodium, potassium, the BUN and creatinine are the kidney labs, as well as the eGFR, estimated glomerular filtration rate. Well, here's the thing. Your eGFR is really one of the main labs we look at when we're trying to figure out if you have kidney disease or not, but it only lights up if it's less than 60. But quite frankly, if your eGFR is less than 90, then already you may have CKD if that's consistent. So make sure you also check out my video on CKD stages, okay? So you can know which videos you need to be alarmed about, even if it doesn't light up. Yeah. Shador, you know, when we have CKD patients, a lot of times they come in and they're really annoyed, upset, you know, that their doctors didn't tell them. They're like, oh, they never told me. I've had CKD3 all of this time. I had chronic kidney disease stage 3, or I've had CKD2. I could have reversed it. That's why I really encourage you to be your own advocates. If y'all have your labs, go ahead and look them up on my chart. Go pick them up. If your eGFR is less than 90, have a conversation with your doctor. If your eGFR is less than 60, you need to come see a kidney doctor like me. Do we have any fours? Do we have any fours? Does anyone know?
We do have
of
a couple of comments. Miss Jewel.
Miss Jewel,
I started following you when I was diagnosed with CKD. I love your information. I had no symptoms. It was a surprise. I have had controlled high blood pressure for years.
You know, thank you so much for following me. I appreciate the support. You know what, Miss Jewel, let me ask you this. Were you following me when we first got Shadow, who was barking at the beginning of this live? Let me know that. Put that in the comment. Because if you were, you'll recall when I first started this channel, you know, I had 3 subscribers. Me, my daddy. Shador, were you one of my subscribers?
Yes, I was one of your subscribers.
And then my daughter, my youngest daughter, well, she was 7 at the time. She saw me with my little tripod struggling, and she asked me, you know, hey, what are you doing? I said, I've got a YouTube channel. And she was like, cool. She was like, how many subscribers do you have? I was like, 3. And she said, that's sad. And so then they made a deal with me, wheeling and dealing kids, that if they helped me to grow my channel, I would get them a dog. And so they were like, if we help get 100 subscribers, can we get a dog? I was like, no. They were like, if we help you get 1,000, can we get a dog? I'm like, no. And so then I said what I thought was a really unrealistic number. I said, I'll tell you what. I said, if you help me get 10,000 subscribers, we'll get a dog. Well, lo and behold, we ended up getting to that number quite quickly. And you see now, I'm very thankful and grateful that we have over 700,000 subscribers. And I have my YouTube dog, Shadow. She is a Portuguese water dog that doesn't like water. Who heard tell of a water dog that doesn't like water? But Jewel, I appreciate you for being someone who's watching the channel and supporting. And you have a good point, because when I was telling the signs and the symptoms of kidney disease, a major symptom and probably the most common symptom early on is nothing. And so that's the importance of going in to see your primary care physician, being your own advocate. And even if they're trying to rush you out of the room, you know, they do that thing where, you know, okay, doctors do it. We do. You do that thing where you kind of have your shoulder toward the door. Okay, then everything looks good. Okay. You stop them, have your questions organized, and you ask the questions, because when you have no symptoms, you don't wait. You don't want to wait until you have symptoms, because it could be too late. But thank you, Ms. Jewel. I appreciate you. I appreciate the support. Any other comments, Shadora?
Yes, we have Queen CC.
Oh.
Queen CC.
Hi, Queen CC. Oh, I like that. What's Queen CC talking about?
She says, in my mom's family of 10 siblings, 6 had kidney disease and required dialysis, including her.
Of the 10 siblings, how many are on dialysis?
6 out of 10.
6 out of 10. Okay. And I don't want to, you know, I don't want you to say anything you don't want to say. If you're comfortable and if you know the diagnosis, please share. If not, don't, and you could DM me. We could talk offline. But I'll just talk in general. Okay. In fact, you don't have to put anything back on there. Number one, I'm sorry that they're going through kidney disease, and there are many things that it could be. So I mentioned that the number one cause of kidney failure is diabetes in this country. The number 2 cause is high blood pressure. 2 things that are oftentimes preventable or at least manageable, right? But when you have it running in a family like that, it makes me wonder, do most of those siblings have diabetes? Do most of those siblings have high blood pressure? And while there are some genetic dispositions to diabetes, and Shador, you know, you see it in the office. Sometimes you have people who come in who are healthy eaters, they're at healthy weights, they drink water, they exercise, and they still have diabetes. You know, sometimes that's the luck of the draw, your genetics. Same thing for high blood pressure. But more times than not, we have people who are living with obesity, which is putting them at risk for the high blood pressure and the diabetes, or who have diets that are high in carbohydrates, high in salt, high in processed foods, high in added sugar. And so I'm curious to know if, you know, if they grew up in the era the way that many of us grew up, especially if you live in the South, where back when the soul food really did consist of a lot of fatty foods, a lot of pork, a lot of, you know, fried things, a lot of carbohydrates, a lot of sugar, you know, that's how a lot of our traditional soul food has been. And if everybody's eating the soul food, and if everyone ends up living with being overweight or living with obesity, then automatically you're at risk for the diabetes and high blood pressure. But then there also are some genetic diseases that could put you at risk, where you could possibly have a family with 6 out of 10 siblings. One of them is, does somebody know what it is? It's a very common genetically inherited kidney disease. If you think you know what it is, put it in the chat. Ooh, I'll tell you, it's ADPKD. Okay, polycystic kidney disease. If you've ever heard of polycystic kidney disease, put a 5 in the chat, please. PKD. And that's one of these autosomal dominant diseases, okay? Meaning that if one person has it, if one parent has it, then with each child that's born, there's a 50% chance that the child will have it. And what happens is you get multiple cysts in the kidneys. And so instead of the kidneys being the normal size, normal for most people, which is about 9 to 11 centimeters, and you know, your kidneys on your flanks, they're in your lower back where the love handles are. So instead of your kidneys being that size, they get very large. They can be 16 centimeters, even bigger. They can kind of push other organs out of the way. You can be short of breath because they're pushing up on your lungs. And people who have this PKD, this autosomal dominant polycystic kidney disease, are at a high risk of developing kidney failure, a high risk of having high blood pressure. And here's something else. They're at a high risk of having liver cysts, and there's a higher association of brain aneurysms, okay? And so, and Shador, you know, HIP is in effect, but we've had patients just very recently, and it happens quite often, when I have a patient and I find out they have a family history of polycystic kidney disease, you know, and certainly if they have a history, a personal history of polycystic kidney disease, I'll ask them if they have any headaches, if they have any neurological symptoms. And if they have a headache frequently, you know, sure, maybe they have migraines, maybe it's high blood pressure, but I screen them to make sure it's not a brain aneurysm. Brain aneurysms can be associated with PKD. Here's the good news, though, about that. For PKD, we do now have certain medications which can help to treat it. And of course, no medication is without a side effect. But back when I was in training, the medication that we now use to treat PKD to help to manage it, it was not FDA approved. But I had the good fortune of actually working with one of the principal investigators, one of the main researchers. I did my fellowship in kidney disease at Emory, and I got a chance to work with Dr. Arlene Chapman. And so I got to learn really firsthand a whole lot about PKD. And now the drug that she was studying back then is now approved, and it can help to slow down the progression of PKD. Not an absolute cure, but before we had nothing. And so I'm sorry you have that strong family history, but I'll tell you what I do hope. That's Queen Cece with that family history.
Yeah, she came back with it. She said they were all diabetic type 2, overweight, and her mom also has high blood pressure. Her uncles have passed away after 10 plus years on dialysis.
I'm sorry. I'm sorry. And see, and that's one of the main reasons I got into it, because it sounds like with those diagnoses, a lot of it could have been preventable. But how do you know? You know, if you don't have someone who is talking to you from the time that you're a child about eating habits, and or maybe even if you're in a situation, I know that, you know, many generations, especially, you know, ahead of ours, you get what you are able to eat. You know, you have a lot of people saying, oh, please go eat organic, eat fresh, eat plant-based. And yes, I agree. I love all of those options, but everyone does not have a Whole Foods or a Sprouts in their back door. And even if they do, everyone can't go afford that for the whole family. So what does that mean? You may end up eating the foods that are inexpensive, like processed foods, or the foods that are places where you can walk to. In a lot of low income neighborhoods, you got the Popeyes and the Churches. Anyway, you got a lot of fried food and fast food right around the corner. And I'm not suggesting that your family was low income, but I'm talking about, well, you know, generations, my family, things of that nature, where just the resources are different. Okay, when the resources are different. And you mentioned 10 siblings. My mom was one of 16 siblings, and my grandmama did a wonderful job raising her kids. But I'm quite sure even if they had Whole Foods back then, she would not have been able to afford to buy Whole Foods for 16 kids. You know, they grew their food, and so that was something that was different. But my point is, when you know that you have a strong family history like that, Queen Cece, I want you to make sure that you're proactive about your own health, okay? And you talk to your cousins, your children, if you have children, your loved ones, you talk to them about eating in a way that will prevent diabetes. Talk to them about going to see a primary care physician, even when you don't have symptoms. Ms. Jewel says she didn't have symptoms for CKD. See your primary care doctor. They will screen you for diabetes with a hemoglobin A1C. They'll screen you for blood pressure, right? They'll do all of those things. Drink the water, do the exercise. The American Heart Association recommends exercising 150 minutes per week, 150. So that's about 30 minutes, 5 days a week. Do all of the things. Just because certain things run in the family, and I mentioned this in my book, Under Pressure, A Guide to Controlling High Blood Pressure. Y'all make sure y'all get this book. But I mentioned it in the book. A lot of people say, well, you know what? Diabetes runs in my family. High blood pressure runs in my family. True. But you know what else runs in families? Frying pans, right? Sedentary lifestyle. We don't have to sit back and just because our family members have diabetes, high blood pressure, we don't have to fall victim to it. We can be proactive and we can get ourselves in a healthy way so we can get on an even playing field, okay, as far as our health, so we can do great things, okay, for ourselves, for generations to come. But I certainly appreciate you. I appreciate you for sharing that story about your family, you know, and I pray for the health of your family. And I really want you to be that educator, that warrior, to encourage your family to have good health, to help to prevent the diseases that are preventable. And for those who already have it, make sure that you're being seen. If your eGFR is less than 60, talk to your doctor about seeing a kidney doctor. And if you have no symptoms, you have no idea what your numbers are, please go see your primary care physician. Thank you.
Hey,
Any other questions or comments before we move to our last topic?
Yes, Poppy Weasel. Which of these tests would you recommend, or could you get from your general practitioner?
Of the tests that we've talked about, okay.
Yes,
so
as kidney disease.
Okay, thank you for that question. So I'll tell you, the screening tests are ones that your general practitioner will actually already do, if you can believe it. Yeah, the screening tests, and so I'll tell you what they are. And so, Poppy, the tests are a BMP, basic metabolic panel, BMP. And as far as the kidney disease, you're looking at the BUN, or blood urea nitrogen, the creatinine. For the creatinine, the lower, the better. If your kidneys are getting rid of creatinine, that's a marker and it lets us know they're getting rid of other toxins as well. and then the EGFR, estimated glomerular filtration rate. So you just go to your primary care doctor, do your history and physical, or you call and you say, hey, I just had a physical a few months ago and y'all said everything was fine, but what was my EGFR? And if you find out that it was less than 90, then start asking questions. But yeah, ask your primary doctor for a BMP. And make sure you check out, I have a video right here on YouTube. It is called CKD stages, chronic kidney disease stages, where I go into heavy detail about those tests. But great questions. All right. Thank you to everyone who's in the chat, to everyone who's viewing. Please go ahead and pause and hit that like button. Hit that like button. Let the good folks at YouTube know that we are here. We're giving evidence-based information live. I've been giving other videos, recorded videos for years. But this live is something new to us. This is only our second live in the nighttime. Ooh, Monday Night Live, Medical Monday. This is Medicine in the News. I am Dr. Frita. This is my co-host and practice manager, Shador, and we are talking about the health topics in the headlines. Okay, we already talked about a few of them. We talked about, should we legalize weed? We talked about Delta-8 THC, or weed light, baby weed, diet weed, as they're calling it, and how a lot of teenagers are doing it. Go talk to your teenagers. They know what Delta-8 is. Ask them if they're doing gummies, okay? And, in the marijuana, and I'm more talking to children for this, and teenagers with their cognitive development, it can sometimes cause issues with focus, okay, issues with memory. So please have conversations with your family. We also talked about multiple sclerosis, because March is Multiple Sclerosis Awareness Month, and we talked about some multiple sclerosis warriors. And now we talked about how March is also Kidney Disease Awareness Month. We'll be talking about kidney disease for the rest of the month, which I guess is ending next week. But we talked about some signs and symptoms of kidney disease. And now we're going to talk about the Married to Medicine reunion, part 3, and some nip tuck confessions. Yeah. Okay. All right, y'all. I thought that was just like real revealing, real transparent moment. And I'm not studying sweet tea. Everybody in Atlanta has not been on the table, but a lot of people have. And I just want to talk right now about some of the risks of plastic surgery. And if you are going to get, plastic surgery, then I highly, highly, highly recommend that you see a board certified plastic surgeon. So let's talk about some of the things. So y'all see Toya, okay? Toya, Eugene's wife, talked about having something done to her breast. I'm assuming a breast augmentation, and to her abs. So as far as breast augmentations, or getting your breast enlarged, getting breast implants. So when you see a board certified plastic surgeon, they'll give you all the options. What kind of implant? Should it be normal saline? Should it be under the muscle? But when you talk to the board certified surgeon, then you'll know that you have someone who's had the proper training, who's met the standardized criteria. They'll have an actual anesthesiologist. They'll be in a place where it maximizes your safety. So I highly recommend you see a board certified plastic surgeon. And quite honestly, if you're here in the United States, please stay in the United States. We have a lot of travel medicine. And I will say there are certain places where they have some US physicians, or they have some of the similar criteria, but there's no guarantee. Okay, so when you go out of the country to get things done, you may save $1, but barato es caro, cheap is expensive. Because if you go and you get botched, y'all know that show Botched, or if you get infected, or even if you lose your life, if you're in another country and you're not really being traced, you don't know what can happen to you. Also, if you come here, you've had an infection, because I've seen it, because I've had patients who've had sepsis. We've had patients who've had surgery other places, they've had sepsis. You come here, and sometimes surgeons don't like to go behind other surgeons. So I recommend getting a board certified physician in the country where you are. You sit up in the United States, please stay in these United States of A. Okay, but with breast surgeries, a lot of them really can be saved, okay? The breast lifts, breast augmentations. But if you do get implants, remember there are certain risks. And SZA, the Grammy award-winning artist, recently shared she had her breast implants removed because of her risk of breast cancer. So let's talk about it. Her mother is a breast cancer survivor, 7 years, and she has an aunt who's had a mastectomy, okay, had breasts removed. And when SZA had her implants, she had a lot of fibrosis, okay, a lot of scarring around the implants, a lot of pain. And she said that her doctor told her that she was at really high risk, like a 53% higher risk for breast cancer. Plus, she was miserable and pain with the fibrosis. And so I'm going to run through some of the complications. But if you go through to my Instagram at dr.frita, follow me there. I have a video, a quick video, like a minute, a short video where I talk about complications. I'll run through them here really quickly. Potential complications of breast implants. One is cancer, especially if you get the textured implants. You can get an anaplastic large cell lymphoma. You can also get other types of cancer, squamous cell carcinoma. Okay, but there can be an increased risk with the implants. You can also get something called capsular contracture, and that's when you get a scarring or a fibrosis around the breast implant. And so it tightens, it can be painful, and it can literally make the breast hard and painful. So the whole point in getting breast augmentation is for the cosmetic, right? The cosmetic look, the aesthetics. But if you have a hard breast, painful breast from contracture, that's not fun. And so just understand it's a risk, okay? Other things you can get extrusion where the implant, like especially if you have relatively small breasts and you have your skin stretched out, the implant can literally break through the skin, and you have an implant that's out of the skin. That's a complication. The implant can flip. It can have you with a disfigured look. You can lose sensation in your nipple and your breast. That's a possible complication. And if you're trying to breastfeed, then sometimes you can have that issue. So potential complication, but make sure you see a board certified plastic surgeon, talk to them. And, I'm not averse to plastic surgery, but I just want to run through some of the risks and some of the questions you should ask. You should ask how many surgeries have they done, ask to see pictures, ask to see comments, make sure that it's in a proper facility, okay, that they don't have you somewhere in a corner in a hotel doing the surgery. That happens, okay? So that's with the breast implants. So Toya also shared that she had her stomach done, her abdomen done. So someone had a tummy tuck on there. A tummy tuck, also called abdominoplasty, is when literally you have, like if you have skin that's hanging over, loose skin, excess fat, they remove the excess skin, remove the fat. And in a tummy tuck, they can also tighten the tissue that helps keep your stomach muscles together. And sometimes in a tummy tuck, they'll also do liposuction where they help to contour your abdomen. If your belly button is out of place, okay, if your umbilicus is out of place, they can move that around in a tummy tuck. There's also mini tummy tucks where they can just do skin and fat removal. And then if you have a pannus, okay, that I think some people call it a fupa. There's a song for that. She got a lot of stomach, but that's okay. Anyway, but if you have the paniculectomy, that's just when you're removing a little bit of the skin and the fat, not with all the other things involved, the tummy tuck. But again, you want to go to a board certified plastic surgeon. There's always a risk of infection and a risk of bleeding. But if you go to someone who is a reputable board certified plastic surgeon, then your risks aren't super high with that, because of course you also will have the medical screening to make sure that it's safe for you to have it done. And then we'll touch just briefly on the lap band, because Dr. Heavenly shared that she had a lap band. That's one of the weight loss surgeries, a bariatric procedure. And that's where you get this silicone adjustable band that's put around the top part of the stomach, and it's adjustable, okay? There's like a tubing that goes out to your skin. It can be made so that there's more stomach available for food or a small amount of stomach available for food. But basically it makes it so you're full fast, and it can help you to lose weight. It's actually now the least popular of the weight loss surgeries. In fact, of the weight loss surgeries in the United States, less than 1% are lap bands. And it also is the least effective as far as losing weight. So you only lose about 40% of what you're overweight. So if you're 100 pounds overweight, then with a lap band, you may only lose an average of 40 pounds. Okay, if you're of the weight that you're overweight, you only lose 40% of that. And so more people are going to the gastric sleeve or to the Roux-en-Y bypass. But that's just one of the things that Dr. Heavenly shared. So I consider that less of a cosmetic surgery and more of a health surgery, because Dr. Heavenly has shared that she was someone who was living with quite a bit of obesity. And if her BMI, her body mass index, was greater than 40, then that's a surgery that really could have been life-saving. But she shared it on the reunion. And so lastly, I want to talk about the most dangerous plastic surgery, even for board certified plastic surgeons. Does anyone know what the most dangerous plastic surgery is? If so, write it out in the chat. What do you think the most dangerous plastic surgery is? All right, Shador, I'm gonna have you play that clip of SZA real quickly. And so we'll talk about that and then we'll wrap up. Y'all, please come on in, like and subscribe to this channel. And Shador, if you could play that clip, then we will close out this room shortly thereafter.
self-love. Nearly 6 months after hinting at undergoing a cosmetic procedure on her sophomore album SOS, the singer opens up about her decision to get a Brazilian butt lift. In an article published May 31st, SZA tells Elle, "I treat my butt like a purse. It's just there to enhance whatever else. And that's why I paid for it, because it works all by itself. I always wanted a really fat ass with less gym time." The 33-year-old then notes the choice came after a period of literal self-reflection, adding, "I didn't succumb to industry pressure. I succumbed to my own eyes in the mirror and being like, no, I need some more ass." On the title track of SOS, released last December, SZA, born Solana Imani Rowe, sings,
"So classic that ass so fat it look natural, it's not."
And on Conceited, she seems to address the speculation about her physical transformation with,
"I just got my body done and got no guilt about it. I just heard your opinion, I couldn't do without it."
Doubling down in February, SZA took to Instagram to show off her new asset by captioning a video for clarification purposes only.
All right. So let's talk about SZA. Okay, SZA makes light of it. She says she got her BBL, her Brazilian butt lift. She thinks of it like an accessory or a purse. Let's be clear. And I like me some SZA. My daughter loves SZA. A BBL is not as simple as having an accessory. In fact, what is the most dangerous plastic surgery? BBLs, Brazilian butt lifts, also called fat transfers. Now for this, even for board certified physicians, at least 3% report that they've had at least one death with the BBL, okay? Even with board certified physicians, this is the most fatal, the most deadly plastic surgery. And so you definitely want to think it through before you get a BBL. So with the Brazilian butt lift or the fat transfer, fat is usually taken from the stomach, like a 360 liposuction, and then it is placed into the buttocks and the fat under the skin above the muscle. Well, in this jabbing, kind of putting the fat there, you risk fat going into some of the tiny veins in the butt, okay? And if fat gets there, it can travel to the lungs. You can get a fat embolus. You can get fat emboli that can go into your lungs or get trapped in one of the big vessels in the heart, head into the lungs, and you can die, okay? And so this is oftentimes a way that young ladies die. And of course, you can get infected because where's the BBL? Is right there near the anus. It's near where fecal matter is. It's near where a lot of normal flora can just be at high risk for infections. And a lot of people, especially when they're looking and chasing after IG models, will go to other countries and they do that medical tourism. And if you get a BBL and they're like, oh, you know, instead of paying this money, we'll give you this little amount of money. A lot of times you do the medical tourism, you don't speak the language, they don't necessarily have the same sterile or clean facilities, and it can be a problem. So just understand, yes, if you go to a board certified plastic surgeon to get your BBL, ask all of the questions. And so again, I'm not sitting up here saying, I absolutely not, don't do it. But understand, it's the most dangerous of the plastic surgeries. And so you are taking a risk of death. So it's not like buying a purse. There's no risk of death from buying a purse. I don't care how big and bad the purse is. So it is something to be taken seriously. And remember, the butt shots, the injections are illegal. I did an interview with Revolt TV where I was talking about this one lady. She was a lady who was doing butt shots. She was not a plastic surgeon. She was not in healthcare at all, but she actually killed someone in doing the butt shots. So that silicone, anything that someone's offering you as a butt shot, don't do it. Okay, it's illegal. And there's also butt implants. Now, I don't recommend the implants. Those things can flip, be disfiguring. If you've ever watched Botched, you've seen that. But yeah, BBLs are something that can kill you. But again, if you're going to do something, consult with your doctor. All right. So we're going to go ahead and wrap this thing up. Shador, do we have any closing comments?
Yes. Where can you be located, Dr. Frita? Miss Pat D is wondering.
Oh, okay. Well, if you go to my website, drfrita.com, that's www.drfrit, as in take care of yourself, a.com. You can see where I am. My brick and mortar is here in Atlanta, but I'm also offering a concierge telehealth service. And so if you have a question, you want a second opinion, if you want to talk and you want to get my one-on-one consultation, go to that website. And also I have it in the link here in the description where you can set up a telehealth visit no matter where you are in the world. Okay. All right. So any other comments before we close out?
Yes. Thank you for all for giving live. I look forward to tuning in more to this channel. This is from Mr. Randy.
Hey, Mr. Randy. All right. We'll be here next Monday for Medical Mondays for another Dr. Frita, Medicine in the News, where we're talking about the hot health topics in the headlines. Okay.
All right. And you have a Healthy Habits handout, no?
Oh, absolutely. Yes. And I'll put the link in the description. Healthy habits for a better life and a better you. These habits are evergreen. So I go and I break down some of the healthy habits I use. Okay. Drinking water, lemon water, exercise, meditation. Okay, I give you all the secrets. So make sure you check out the link in my description for that download. Okay. Healthy habits for a better life and a better you. It's a free download. And if you follow it, it can really change your life. Make sure that in anything that you're doing with your health, you consult with your physician. But today, Shador, we covered some hot health topics, didn't we? We talked about weed should be legal. And I see those votes in the chat. Some of y'all want it to be legal. And we know that the Biden-Harris administration wants to go from Schedule 1 to Schedule 3. So it's not thought of as being as dangerous as heroin and more dangerous than fentanyl. We talked about Delta-8 THC, which is considered to be baby weed. But guess what? It can have you feeling higher than a kite, or like, Mary J. Blige and Method Man, so high you can touch the sky. It can do that too. So talk to your teens, because a lot of teens are doing Delta-8. They might think it's benign, but it can cause some issues, cognitive issues, focus issues, memory issues. And even with adults, there's been an increase in the poison control hotline. It's increased by 82% just on Delta-8 alone. So watch out when your kids are eating gummies, candies, cookies, and these kind of odd looking but fancy childlike containers. Make sure they're not sitting up there getting high on their own supply. Delta-8 THC. Watch out, teenagers. But hey, maybe we should legalize weed so we can regulate it, legalize marijuana, and we can check it out. We talked about multiple sclerosis, Christina Applegate, Jamie-Lynn Sigler, and we talked about them living with the illness. We talked about autoimmune diseases. And then we talked about Kidney Disease Awareness Month, because March is Kidney Disease Awareness Month. And I gave you some of the signs and symptoms of kidney disease. And Ms. Jewel gave us a very important symptom of kidney disease, which is nothing. So it's important to check out your primary care physician. And last but not least, we talked about Married to Medicine, the reunion, and the Nip Tuck Confessions. We went through some of the complications of plastic surgery, and I revealed the most dangerous plastic surgery of all, even among board-certified plastic physicians, and that's the BBL. Hey, don't knock it till you try it, probably. I don't know. I try not to be judgmental, but what I will say is that you want to make sure you maximize your safety. See a board-certified plastic surgeon. Cheap is expensive. And if you're in the U.S., stay in the U.S. Don't do all that medical tourism. But that's it for this week's Medicine in the News. We'll be back here next week, 6:00 p.m. Eastern Standard Time on Monday for our Medical Mondays. That's a wrap, Shador. All right. I'm Dr. Frita. Thank y'all for joining. Hit like on your way out now and subscribe.